Shortly after we arrived back in the area, and my wife became very ill, substantial amount of pain. Within an hour, I brought her over to Swickley Valley Hospital into the emergency room. She had a very serious blockage, and to make a long story short, the next day Dr. Dobler operated on her and essentially saved her life. So it really showed me the value of having the type of facility we have in Swickley. I do reflect on so many memories because my wife has been quite ill a number of times, and I know that walk up and down the hill very well.
I delivered both of my daughters at Swickley Hospital, and both experiences were amazing. The first one was particularly amazing because my first daughter was born with a very low APGAR score, and I had an amazing nurse that resuscitated her and took care of her, and she's perfect. She was perfect within 10 minutes. She had fully recovered, and that nurse won a service award that particular year, and I was so happy for her because she was so helpful and caring and concerned and compassionate, and she just wrapped that all up into the care that she gave me at that moment.
And it's just a comfort to know that everything we need is right here and we can access it on a timely basis. So when I look at that hospital, I just feel sort of a sense of comfort. And it's reassuring, and I hope that never goes away.
I think a local hospital in the community is really the lifeblood of the community. I mean, not just for the jobs. Heritage Valley is the largest employer in the area. It's really about, could you imagine living in Beaver or living in the outskirts of Beaver and having to drive into the city to get any kind of care?
We're lucky to have very wonderful, compassionate people working in our system. They know the population, they know their neighbors, they know the community. There's a personal touch.
This hospital has had a history of being supported by the local residents, and that goes back a number of generations. And we realized it was a real vital part of the community, and that's why we got involved.
I devote my energies to Heritage Valley because I strongly agree with their mission statement and their philosophy. Heritage Valley accepts all patients. It doesn't matter what insurance policy they have. It doesn't matter if they can or cannot pay. Every patient is given the best treatment. You can have good health care, and that is very important to every person. But unless you have good access to health care, that is what's really vital to every person.
Swickley provides great care and a great emergency room. And when you take into consideration that they are an economic driver by everyone working in Swickley, shopping in Swickley.
Especially for the members of this community, to be able to have that close to home and close to their families is a wonderful, secure feeling.
Rural health care is the lifeblood of the community. And when it goes away, it really does change the whole landscape of the community that it's in now. And we don't want to see that happen.
The big changes that the medical system is going through, this hospital is staying on top. And they're giving the best possible service and care they can. With the competition today, with the cost of doing business today, hospitals are, I don't know how most of them are surviving. They have to rely on philanthropy.
The hospital gives over $20 million in community services every year. Part of that is charity care. Part of it is prescription care where people can't afford their own prescriptions before they're released from the hospital. There's nutritional programs that are available, diabetes programs. These are all run through the foundation, or a large portion of them is run through the foundation for the hospital, and I think that's another way that the foundation really helps the hospital out for the future.
Those foundation assets allow us to invest in state-of-the-art equipment, invest in physicians, expand our network through walk-in clinics and accessibility to the community. That financial flexibility that a very large endowment provides us means that we can also be strategically flexible to invest in service lines, invest in other areas of business that will allow us to complete that continuum of healthcare that we want to provide over the life of our patients in the community.
During the last 18 months, it's been a pleasure to work with both foundations. I feel truly blessed with the people that are on there. We get things done, and we are continuing to work to raise money for capital projects, and we are doing such joint ventures as the wine event, there's golf outings, there's the jazz music series, all of which benefit the hospitals, both campuses.
Both boards really understand the need for a regional approach. And to get to that point, we've been having our joint board meetings with both the Swickley and the Beaver board for probably the last year and a half to look at the synergies between the two boards, how we interact, how the personalities work. And it's really been a great situation. Everyone seems to be on board with the initiatives that we're coming up with. It kind of gives us a bigger brain trust to talk about things that the foundations can help out with. And we get a better understanding of the Swickley community versus the Beaver community, which we're going to have to do in the future.
We've done a great job. We've kept our bond ratings, which a lot of hospitals haven't. And that's what impressed me originally when I worked on the foundation, was the focus on the bottom line and on technology.
Everyone is into giving money for the community, giving their time for the community, but there's an awful lot of things to give to anymore. And trying to carve out a niche for the hospital has been a real challenge. And I think, again, that's why the regional portion of what we're trying to do is going to help us in the future. Probably the biggest thing that we have is engaging the community, is getting them to understand and get behind the initiatives that we're trying to support and build as the foundation.
Well, when I was little, my grandfather made wine at home. We always had a bottle at his table, and in those days, you cut it with a little ginger ale. It was so strong. Red wine, of course, only real wine, red wine. And it was always served every meal. Then all my life, I just kept on enjoying wine. Foster was my mentor. He got me to join the hospital group and found things for me to do. And I said to Foster, I want to be involved, but I want to be involved in the fundraising end of it. And because this is my life, this is my neighborhood, this is how I pay back all the people who contributed to my success by helping them with the hospital. And he said, let's do a wine festival. Having a wine event was a great way to give back because it got everybody in the community who liked wine involved. And they saw my enthusiasm. And then when you see somebody having a good time, and then you say, this is a good cause, turn your good time into the cause. And that's really was successful that way.
The room that we dedicated for Alex Sebastian and his family was really a great honor for Alex. The times that he has spent and the effort that he has done over the years with the biannual wine event, which really benefits both of the foundations, has really been a great thing for the whole hospital system.
I chair the Unique Boutique, and it's a fundraising event for Heritage Valley Hospital. Each year we pick one program to donate all the proceeds to. Last year it was the Heritage Valley Breast Care Program. We have 50 vendors. We have around 450 to 500 shoppers, and it's busy. I get an email from one of the Swickley vendors. She told me that after 10 years, her mother's breast cancer had returned and was undergoing aggressive treatment for it. But her mother came to Unique Boutique, she shopped, she bought all these gifts for her family and grandchildren, and she looked around and she saw all these, mostly women, supporting the cause. And she saw women taking the pamphlets from the table of screening, of treatment, and she smiled. And she said to her daughter, this was a day that gave me great happiness. That happiness of her mother fulfilled me. It nourishes my soul. And that simple acts can make such big changes in people's lives.
Every time we've raised money to see what it goes to and how people respond, I was the fundraiser for the new emergency room. And the day we dedicated it and the day we had everybody here at the ribbon cutting, that was worthwhile. I mean, that was wonderful to see the people come out and support something they really, really needed because they knew how much they had to wait in the emergency room and how we needed a bigger, better place. And even though it took 3 or 4 years, it was worth every minute of my time.
It's easy to help the people around you, your parents, your grandparents as they're aging, your children. You get that same sort of sense of self-fulfillment when you reach out to those around you that you don't know personally.
We have to raise money to succeed here. We have to give as much as we can to the hospital. And we have to recognize those people who give money to the hospital, because then when people see they gave, then they'll give.
You can't give the free care that we give without having adequate resources. You can't do the community outreach that we do without having the resources. Obviously, we need dollars to improve our technology, which we've done substantially since our last campaign, but that's a continuing effort.
I'm very proud and I feel very grateful that I'm on the foundation board. It gives me a sense of giving back, but it gives me a sense of participation that I know that there is good being done.
Well, I've given 4 commencement addresses in my time, and all 4 of them were that. They have to appreciate what's happening in the world, and they have to give back. They have to be involved in some kind of charity, any kind of charity, big or little, and they have to get involved. Doesn't have to be financially, and they can afford it then financially, but they have to give their time to make this world better.
It takes one person to make a difference. It takes one person to believe that they can change the world. And it takes that one person with a plan to make those actions. The change does not have to be tremendous. The change can be simple. And it is those simple acts that can make a tremendous difference in someone's life.